Hello everyone. Today we are going to study about the minor disorder of newborn. Okay. So minor disorder means the disorder or disease condition that can be treated without any heavy medicine or will be pharmacological management like normal nursing management and home remedies, or with the minimal medicine we can cure it. Okay. So first starting with the introduction. The minor disorder are most common among newborn. Neglecting the minor health problem is one of the factor contributing to the newborn mortality rate. So it is very common in newborn, but if you neglect it, it can cause the mortality rate increased. The definition of newborn, as we know, from the birth to the till 28 days of the baby is called as newborn or neonate. Okay, from the birth up to 28 days, we'll consider the baby is newborn or neonate. The definition of minor elements. The minor elements are a physical condition in which there is a disturbance of the normal functioning. So when the function of the body of the baby is not going well, or it's like it is not doing properly, then we can call it is minor elements. Then that first one is stuffy nose. So it may be lead to mouth breathing and excessive air swallowing, which in turn may lead to the abdominal distension and vomiting. So how we can treat it? We can use nostrils. Okay, we can clean the nostrils with the cotton wool soak or with the normal saline. So no need to go for any further pharmacological treatment. Next one is sticky eyes. So it may be due to the bacterial conjunctivitis due to staphylococcus. You can see in the picture how it looks. And what is the treatment for use? Use of erythromycin 0.5% ointment every 6 hours for 7 to 10 days cures the condition. So if you use erythromycin, how much? 0.5%, that is ointment, okay, cream. Every 6 hours for 7 to 10 days it can be cured. Our next disorder is skin rashes. So small patches usually to the napkin areas may involve in the groin, axilla, face and the legs and the back. Treatment is frequently care. Okay, like if you are changing the diaper frequently, wet napkin, and if you are making the baby body to clean, it can be cured. Oral thrush. It is a fungal infection characterized by the white patches in the mouth and tongue, and it should be treated with the when in the mother is pregnant, that time if the mother is having vaginal candidiasis, it can cause the oral thrush to the baby. So if that vaginal candidiasis of the mother should be treated during antenatal period itself, and after each feed clean the baby mouth and mother nipple also. The next one is neonatal jaundice. So it is very common. It is a yellow color of skin usually on the face, abdomen and legs. Why? Because of increased bilirubin level in the blood. So what is the treatment? Usually correct itself in a few days. If not, the baby should be kept on phototherapy. So normally you know that for the jaundice we have two categories. One is physiological jaundice, one is pathological jaundice. Physiological jaundice not needed any treatment within 3 or 7 days. It will cure automatically. But in case of pathological jaundice, you have to go for treatment, you have to go for phototherapy. Next is vomiting. Due to faulty techniques of breastfeeding, means there is some certain techniques or position for the breastfeeding. If mother is not following that, it can cause vomiting to the baby. And the treatment is proper techniques of breastfeeding in proper position and avoid bottle feeding, because after 6 months you should advise the mother to go for exclusive breastfeeding, that is only breast milk, no other things they should give to the baby. Next one is diarrhea. It's due to intake to the maternal medications such as ampicillin and any other drugs. It means when the mother is taking any antibiotics, okay, like ampicillin or any other drugs, okay, it can cause diarrhea to the baby. Okay, what you have to do? You have to put on the exclusive breastfeeding. You have to avoid the bottle feeding, and you have to ask the mother to wash their nipple before and after each feeding. Next one is neonatal constipation due to insufficient fluid or milk intake. Okay, if the baby is not getting sufficient milk, it can cause constipation, and more common in bottle feed infant. Like it is this constipation you can see morely where the baby is bottle feeded. Okay, what management? Give proper breastfeed and apply lubricant over the anal region. The next minor disorder is sore buttock. What is sore buttock? It is a, like you can say, like redness with the swelling where the due to frequent loose stools and the poor hygiene. Okay, in case of diarrhea, okay, what happened? That area will be sore in the buttocks, and if they are not maintaining the hygiene properly also, what is the treatment we can give for it? Change the position from time to time, put the baby on lateral position or front position, and apply coconut oil. The next minor disorder is umbilical granuloma. You can see in the picture, it like where the area around the umbilical cord become moist and may swell and the bleeding may occur. If you see what happens in the umbilical area, it will be moist, there will be swelling and there will be bleeding. What is the treatment for it? You have to treat with the silver nitrate. As I told you, all the minor disorder will be treated. If you treat it early, it will be treated with the minimal management. Okay, that's why they have called it minor. It is not major condition. So with this we have completed all the minor disorder in the newborn. Okay, thank you everyone.